They are the center, most focused part on your face, which most people don't know about, is that the lower eyelid blepharoplasty can be done to also do a very subtle mid-facelift. These things are super confusing and all you're trying to do is get the best looking eyes. But remember, if the top part looks good, you want the top and the bottom to match. How do you know whether you need a canthopexy, a canthoplasty, a browpexy, a blepharoplasty, These things are super confusing and all you're trying to do is get the best looking eyes. Let me walk you through what are some things I look for when I'm evaluating a patient and what are the things you need to know when you're coming in for a consultation, because I might recommend a canthoplasty and you'll have no idea what that is. I'm Prem Tripathi. I'm a board certified facial plastic surgeon practicing in the San Francisco Bay Area. And let's chat first about the eyes. So most people want their eyes to look and match how they're feeling on the inside. They're the first thing everybody looks at. You want your eyes to look bright. They're the center, most focused part on your face, and they really should be the center for any cosmetic treatments you do. All the treatments should be focused at bringing back brightness to your eyes. And so if there's heaviness, sadness, downturned areas, brows coming down, these just detract from your mood. They make you feel and look more tired, and the goal is to just minimize that. So let's start first with a blepharoplasty. A winged upper eyelid blepharoplasty is something I do. I've not just developed it, but I made small tweaks to it to make it my own signature treatment. That is a surgery that focuses on the lateral edge here, where most people have excess skin and want a blepharoplasty. So when that skin is coming down towards your lash line and making it so you can't see the crease as much, that makes you a great candidate for an upper eyelid blepharoplasty. It's not gonna make your eyes look bigger. It's not gonna change the shape of the eyes. It just takes that heaviness off of that area, especially when you're trying to put makeup on. So a winged upper eyelid blepharoplasty softens and makes your eyes look more youthful and less tired. But here's the catch. There are other features that can make your result look so much better, especially if they're causing more issues than just the blepharoplasty. And the next one I'll talk about is a browpexy. So if your brows here are coming down also, that skin can push down on your eyelid crease. So I can hack away as much skin as possible on there. You're gonna not be able to close your eyes, but it's not gonna take and treat the actual problem. The problem is that you have brow skin coming down to that lash line or to that crease, obscuring that area, also making you look tired. Can you imagine, like, if you looked like this, you're gonna look a lot tired than if the brows are higher. A browpexy is an in-office procedure that you can do at the same time as a blepharoplasty. The incision is hidden in the crease and the brows are suspended through an incision in that area and suspended with sutures. That's a little different than a brow lift, which usually requires anesthesia, and in some studies have shown that a browpexy and a regular brow lift have similar longevity, but a brow lift requires much more dissection and release, and in some cases you could consider that this might last longer, but it's very patient dependent. If you're already having a blepharoplasty and you don't want anesthesia, this is a nice one to do in the office, and you can see if you like the results, and if you want a brow lift down the line, that's another option too. But here's the thing too. So I have patients who are concerned about eyelid skin excess, droopy brows, but also that their eyes feel downturned, meaning that the lower lid also seems like it's going down or the edge is kind of coming down. So what do we do for that? If you don't have a bag under here, excess skin, but you also need skin on the top removed, what I can do is something called a canthoplasty. That is suspending the lower lid up so it's a little bit tighter, and so that everything looks a lot more contoured along the upper part of the face. So you get a browpexy, you get a blepharoplasty, and you get a canthoplasty. That makes things look snatched. It makes it look brighter. It makes your eyes look a lot more youthful without, again, changing the shape of your eye. Now, you may have seen patients that have lower eyelid blepharoplasty, and for those patients, I always perform a canthoplasty just as a little added insurance policy to make sure that their lid doesn't retract or come down like this. I will suspend the eyelid up, but in those cases, we're really overcorrecting it so that it's really tight at the time of their surgery because we know it's gonna wear off eventually. Another canthoplasty technique that I use is actually suspending the lower eyelid muscle. I do that through the same incision. And when you do that again, things look softer and more snatched. The last thing is a lower eyelid blepharoplasty. And I want to remind you that that could mean so many different things. That could mean just removing skin. It could mean removing skin and fat. It could mean transposing fat into the lower lids, putting fat into the cheeks. Again, with the same goal, to minimize crepiness under the eyes, to make dark circles look better, and to make bags disappear. That is the ultimate goal. So I would focus less on the kind of technique, but remember, if the top part looks good, you want the top and the bottom to match. And I understand that your goals are the most important, but it's just like renovating. If you renovate your kitchen, your bathroom's gonna start to look a little uglier too. So you might wanna come in for the second one, or just be told right up front that the lower eyelids might need a little work to give you the best possible result. The thing about the lower eyelids is that I do require anesthesia for lower eyelid blepharoplasty when I'm taking bags and moving them down into the cheek, because that procedure goes through the eyelid. There's no scar at all. And for that, I want you to be safe and I want you to be comfortable and not have to worry about needles and stuff going through the eyelid. But other than that, again, it's a super simple, well, it's a straightforward procedure, I should say, where those bags are moved down into the cheek, and then we take fat and blend it throughout the entire cheek, and I'll put fat in other parts of your face as well. The lower eyelid blepharoplasty, again, is a technically more challenging procedure, carries a bit more risk, it's still low risk, but again, it takes your results to the absolute next level. And the last thing I'll tell you, which most people don't know about, is that the lower eyelid blepharoplasty can be done to also do a very subtle mid-facelift. Through that small incision in the eye, you can actually take tissue that's lower in the cheek and pull it up. And that procedure is not frequently done as much anymore because deep plane facelifts really release and create the longest lasting and most natural looking result. But if you're already in that area, a small mid-face suspension can really take, again, the result to the next level, especially if you're not getting that full facelift. So again, all of these treatments, canthoplasty, canthopexy, are all done to rejuvenate the upper eyelid, make it look softer, make it look more youthful. You're gonna continue to age and that's fine. The last thing I'll talk about, which I don't do very much of, I send those patients out, is a canthoplasty. You might see that word. That's where the eyelid is actually suspended by cutting the little tethering ligament there and reattaching it. That, in my experience, is mostly done for patients that have complications from lower eyelid blepharoplasty or have Bell's palsy and have a retraction of their eyelid. So it is for another day. But remember that an upper eyelid blepharoplasty is one very small piece of the puzzle. It's a super impactful procedure, but small little tweaks like browpexy or canthopexy are nice little add-ons to make everything look a lot more youthful and a lot softer, still giving you a very natural result and giving your eyes to match how young you feel on the inside. If you like this type of content, like, subscribe, follow for more. I'll see you guys next time.